Seating and dismissing the patient. Greeting the patient in the waiting room, introduce yourself and ask him to follow you. Hello, Leanne. I'm Andrea. Would you follow me, please?
Sure.
At this time, I'm going to check for any personal belongings. And I'm going to place them on a hook located in the operatory or on a counter close by. All right, I'm going to ask the patient to sit down with her bottom all the way back in the chair and to sit up nice and tall. This is good ergonomics for the patient and the dental team. The dental chair will be able to support the patient's lumbar and relieve pressure from their knees at the knee break in the chair. At this point, you want to adjust the patient's headrest. Move the headrest up and adjust it so it supports the patient's head in the occipital region. Rest your head back. The operator will make final adjustments prior to the procedure. At this point, I'm going to offer my patient a napkin, if they're a woman, to remove any lipstick. You don't have any on. You will then place the patient napkin with the plastic side facing them. Review the patient's medical dental history and ask them if they have any questions about today's procedure. And then we're going to place any x-rays on the view box. Now we're ready to adjust the patient to the supine position. You want to make sure that you're telling your patient that we are going to recline them now. I'm going to recline you now. Now you can adjust the overhead light by turning it on, bringing it to the patient's chin, and then turning it off. Place the operator chair and the rheostat in the operator's position. Place your PPEs on, your mask and eyewear, and proceed to wash your hands. And now you can don your patient exam gloves. At this point, you will prepare the air-water syringe, the saliva ejector, and the HVE if you are using it, and any other instruments that you need for the procedure. At the end of the procedure, you will rinse and evacuate the oral cavity with the air-water syringe and the HVE. You want to wipe any debris off of the patient's mouth with their napkin. Adjust the light back to the original position. Remove the operator chair. The bracket tray so that they don't trip on anything, and the rheostat out of the patient's way. Okay, return your patient to the upright position. I'm going to sit you up now. Ooh, sorry. Remove your PPEs. Wash your hands. Remove the patient bib. And dismiss your patient back to the waiting area.